So in this video, we're going to do both the anterior load and shift and the posterior load and shift because your patient is in the same position for both tests. You have your patient seated on the table and you are going to support them with your forearm while your ring finger palpates their coracoid process and your middle and index finger are palpating the humeral head. And so you're going to use your thenar eminence and you're going to grasp as close to the humeral head as possible and provide an anterior translation for the anterior load and shift. And then with your pads, you're going to provide a posterior translation for the posterior load and shift. And so for this, what you're looking for is pain, apprehension, clicking, or excessive movement. So anteriorly, we should be getting about 7 millimeters, and posteriorly, you should be getting about 9 millimeters, and any of those would be a positive test. So when we're looking at a positive test for anterior load and shift, that means there's laxity in the anterior glenohumeral ligaments in the anterior capsule, and then for posteriorly, it's laxity in the posterior glenohumeral ligaments and posterior capsule. However, it's good to note the position that their humeral head starts in, because if they're already started in for say an anterior position, it will affect the amount of motion you get both directions.